You're hot, you're cold, you feel sunny one moment, cloudy the next. No, it's not just another day of weather in Northeast Ohio. These are some of the symptoms of menopause. Dr. Stephen Waite has tips to tackle this time of transition. Dr. Waite is an OBGYN and the director of gynecologic surgery at Metro Health. Thanks for joining us, sir.
Welcome.
So, the heat's on. Tell us what women can do to cool down those hot flashes.
Yes, there's several options that are available. There's herbal remedies that sometimes can be helpful. There's non-prescription medications. There's prescription medications that are not hormone therapy, and there's hormone therapy.
So when you said, non-prescription type things, soy,
Yeah, the interesting thing, there's some misconceptions out there, so it's always important to look at the effectiveness of a product as well as its side effects. Soy was just recently shown not to be beneficial.
Okay.
With menopause symptoms, yes.
All right, so talking to your doctor can help you know what's good, what's not good, what to try, what not to try.
Right.
All right, other things that people can get.
Yeah, there's potentially some benefit from black cohosh, red clover. There's a few over-the-counter
ones. Those are herbals.
Herbals, right. There's a few over-the-counter, for example, Remifemin, Promensil. But those are only about maybe 40 to 50% effective with hot flashes.
All right.
So really, if you need to have really good control, probably hormone therapy is the best.
Right. Now, with hormone therapy, I know some of our viewers are probably thinking, I thought that there was some breast cancer problems there.
There was a big study that came out about 12 years ago called the Women's Health Initiative, and what that study showed is that an increased risk of breast cancer. And so almost overnight, hormone therapy dropped off significantly. There were some problems with that study, though. The problems were that it was confusing to people. For example, with breast cancer, the background rate of breast cancer is about 30 per 10,000 women. If you go on hormone therapy, it goes up to 38 per 10,000 women.
Just from 30 to 38 per 10,000?
So less than 1/10% per year risk of breast cancer. So it's real, but it's small.
So would you say that there are still people who can be helped and should be helped by the hormone replacement therapy?
Absolutely. When you look at this, there's quality of life issues. If a woman is not sleeping, if she's having problems with hot flashes during the day, possibly some depression, this is a therapy that can really help her quality of life.
And I understand that there are other benefits potentially to the therapy.
Yes, there are. There is a decrease in colon cancer, which this similar study, or the same study that I talked about earlier, talked about. There's potential for Alzheimer's reduction, and there's also potential for fracture, osteoporotic fracture.
All of which are very, very important, obviously. And can women make lifestyle changes to reduce the symptoms of the menopause?
Yes, as a woman gets older, her muscle mass starts to decrease. So what I really try to incorporate in my practice is regular exercise, which will help not only with the cardiovascular, the heart, but also with her bones. Making sure that they have adequate calcium and vitamin D, especially here in Northeast Ohio. We have not, as you can see, not too much sun.
And there's an event where Metro Health is going to be talking about all this stuff and a lot more. Tell us about that.
It's going to be at the North Royalton County branch, and that's March 21st at 7 p.m., and that's free.
All right, and anybody can go?
Anybody can go. If you want more information, there's a number to call. It's 440-237-3800, or they can go online to www.cuyahoga-library.org.
And it's called What's Hot, What's Not. It's a great program, and we appreciate your giving us a little bit of a sample today.
Thank you.
Thank you, Doctor. You want a forecast that doesn't include hot flashes? Follow Dr. Waite's advice, and for more help, attend Metro's free health talk, or use the number that's coming up next. My thanks to Dr. Waite, and I couldn't hold myself back. Thanks to Dr. Waite for weighing in on this topic. We'll be back.
To schedule an appointment with Dr. Waite at Metro Health, call 216-778-3541. And to learn more, go online to www.metrohealth.org/OBGYN. Next, the realities of required minimum distributions.